I'm Sue. I'm a nurse practitioner and I own About Face in Bristol, Tennessee. Today I want to talk to you about something that's very common among men. Men's sexual function or dysfunction, erectile dysfunction. Now it's thought that over 50% of men after the age of 40 suffer from some type of erectile dysfunction. Now, we've all heard about the medications that are available, such as your Viagra, Cialis, Levitra. But for some reason, many men do not want to take this medication. Perhaps it's because it's expensive. Perhaps it's because it doesn't work as well as they think it should. Perhaps they have a medical condition where these medications aren't recommended. But today I want to talk to you about the P-shot. This is a new procedure for men's sexual dysfunction that was created by Dr. Charles Runels. Dr. Runels is the creator of all the vampire procedures. I trained with him last spring and I was amazed at the knowledge he has about PRP and the procedures, all the vampire procedures. It's just amazing to learn about this. I trust him. I have great respect for him. And so when I was training, I was very interested in the P-shot because at one time I had a medical practice and I saw everything from newborn to 96 years old. Now, when my male patients would come in, I don't think they ever left without telling me how comfortable they felt talking to me. I'm not sure if it was the being a nurse practitioner, being female, being a motherly type. I'm not sure what it was, but my male patients always told me that they felt very comfortable talking to me about any subject. So we often talked about erectile dysfunction or the problems they were having with their sex life. And I actually saw three groups of males. You would have your 30 and below individual that maybe had just finished a bad relationship, maybe had lost his self-confidence. And so he would ask for a prescription of Viagra or one of the other drugs. And then you would see your middle-aged guy, 40 or so, and he was having an okay sex life, but he felt it wasn't what it used to be, and therefore he felt like maybe one of the medications would help him perform. Maybe he didn't last as long as he used to, or for some reason he just wasn't happy with his sex life. And then you had the third group, which was over 70, and they had lost their ability to get erections or keep erections and get hard enough maybe to penetrate and to have a good sexual experience. So any of these individuals would benefit from having the P-shot. Now, what is the P-shot? The P-shot, as with any of the vampire procedures, when you come into the office, we do a very simple lab test on you. We draw a little bit of blood. It's just a little bit, maybe 4 tablespoons. We spin it down here in our special FDA approved centrifuge. And when that spins down, it separates. The red cells go to the bottom and the platelet-rich plasma comes up to the top. And we don't need the red cells for this procedure. We only want that rich plasma that's rich in growth factors and healing factors. And so after we numb your penis with a very strong numbing cream, we take a tiny needle and we re-inject this platelet-rich plasma, or the PRP, with all your growth factors and healing factors back into your penis. And now that sounds very painful, I know, but believe it or not, men tell me they have no pain, so you can expect little or no pain. Once we have re-injected this platelet-rich plasma that has your growth factors and healing factors, we can see new tissue, new blood vessels. It regenerates the tissue of your penis, so you can expect an enhanced sexual experience. There's no side effects. It takes little or no, 15 to 20 minutes in the office, and you can expect longer, more sustainable erections. You have a better sexual experience. It can increase the size of your penis, both in girth and length. There's no downtime, as I said. It's done in an office in a very private setting, but best of all, it restores your self-confidence. So if this is something that you are interested in, I would appreciate you calling the office for a free consultation. I would love to talk to you more about the P-Shop.